Hello, this is our multimedia discussion board presentation for week 6. Our group name is Change Through Leadership, and the team members include Inez Short, Damaris Martinez, Deja Grant, and myself, Jacqueline Martinez. In this presentation, we will address the County Board of Supervisors and present policies addressing homelessness in Riverside County. Good morning, Chair Karen Spiegel serving and Mr. Gutierrez as Vice Chair, as well as the members of the Board of Supervisors. We are here to present a policy analysis on homelessness. Homelessness is a critical systemic and social issue driven by the lack of affordable housing, economic inequality, and sufficient social safety nets. In Riverside County, approximately 4,000 people are experiencing homelessness according to the last point in time survey. These individuals include children, teenagers, adults, and seniors alike. This slide represents an overview of all the stakeholders, which include nonprofit organizations, county organizations, and private organizations.
Housing First is a federally supported homeless policy developed by the U.S. Department of Housing and Urban Development, HUD, which is implemented at a state level and local levels. In Riverside County, this policy is carried out through the Continuum of Care system, which it coordinates housing and services across county agencies and nonprofit providers. The Housing First policy focuses on placing individuals who have experienced homelessness into permanent housing first, without any pre-existing requirements like sobriety or employment, meeting the client where they are at. Once a client is housed, they are connected to supportive services such as mental health, substance abuse, and case management to assist with a long-term stability. Strategies also include rapid rehousing, permanent supportive housing, and the utilization of the coordinated entry system. Overall, the Housing First policy has helped increase housing stability, reduce chronic homelessness, and decrease utilization of emergent services. Funding comes from a mix of federal HUD funding, California homelessness funding, and the Riverside County Behavioral Health Funds, totaling millions of dollars each year.
For our second policy, we went with a prevention strategy. So implementing an eviction prevention program. And this would provide educational resources, financial assistance, and legal support to at-risk families facing eviction. Our anticipated outcome would be to keep families housed by providing resources and intervention early in the eviction process. The goal would be to reduce the number of homeless individuals in Riverside County by 5% annually. This timeline would consist of 1 year. And for our budget, we would request homeless housing assistance and prevention grant funding.
The third alternative policy is named Adopt a Community Infrastructure. This allows for an out-of-box solution which can potentially evolve to a conformity model for local cities to adopt. The goal is to create a hub of tiny home villages with staff 24/7 that provides supportive services including individual tailored jobs, communal and sustainable nutrition, mental health services, education, and improving essential hygiene. The measurable outcomes are looking at the number of individuals transitioning from tiny homes into permanent housing, individuals going through the workforce program into permanent jobs, individuals obtaining a higher education, and lastly, individuals becoming mentally stable with the appropriate services provided. This is reflective of a 5-year timeline to be able to gather data and in order to understand if this policy is efficient and effective. The funding for this policy would be dependent on federal, state, and local government. In addition, working with many nonprofits may decrease the amount of funding, as this policy would need millions of dollars for implementation and sustainability. Our evaluation matrix and justification chart compare all 3 policies when it comes to effectiveness, cost efficiency, feasibility, long-term sustainability, cost of implementation, flexibility and adaptability, and lastly, the risk of unintended consequences for each policy.
So after review of the current policy in Riverside County and our 2 policies that we presented as alternatives, we came to the conclusion that Housing First, which is a current policy, would be the best option to address the issue of homelessness. So there has been some really good benefits from Housing First. So over this past year, there has been a 19% reduction in homelessness in Riverside County. and this strategy seems to be working. It quickly gets people off of the streets, it improves their overall health outcomes, and ultimately leads to stable household. So we think that this current policy is working and we don't need to change it.
Lastly, we'd like to thank Supervisors Karen Spiegel, Supervisor Gutierrez, and the Board of Supervisors for your time. Thank you.